40 million people had their eyesight restored because of the work of lions. And that's a lot of people. But when you think of the impact economically on the communities of what that means to a country like Indonesia, when you could have all those people who are blind and unproductive now suddenly productive, what a difference could be to your economy and to the future of your country. Most of the blindness causes are preventable. And we like to work in the prevention area because prevention is a lot cheaper than cure. The difference between urban and rural areas, what do we need? What are the human resources that are required? And that is why this program has human resources and training built into it, so that we build for the future. In 1997 was my first visit to Indonesia. And my job at that time was to help the Indonesian Lions build their leadership, build an infrastructure. And it gives me great joy to see some of them sitting here today. Young, enthusiastic Lions in 1997, now district governors, council chairmen, have elevated themselves up the ladder and become quite successful leaders in this organisation. The same principle will apply to this. Just talking with Professor Keith, Jill this morning, or as you call her, Prof. Jill. Jill, I said, what is the next step? We have this one running, what is the next step? And the doctor was talking about this morning about where do we go? You know, the social responsibility. And I said to her, we need to go to Medan, Palembang, Jakarta, Solo, Bandung. All of those places need to have this facility. If we are going to make an impact on site in this country, we need to be able to do that. We need the resources and the equipment. The Makassar, or the local district, and for the specialist services of Makassar. We need to expand this model. We have the model, we're getting the data, but we need to be able to do that now and put it into the Indonesian health system so that the preventable, avoidable blindness and services for those who need it. As of yesterday, you have confirmed your new president, Jokowi. Jokowi is a member of Lions. My mind is going. We have the man at the top say, yes, this is good, we have a good chance. Do you think? I'm sure we do. So let's start working on getting Jokowi on side, also President Jokowi on side, and working with the governors and the doctors at local level, national level, and the Lions involvement. And I said to Professor Jill this morning, the Lions need to take a lead in pulling all these people together. We need to have the local government, we need to have the national government, we need to have the